Hello everyone, welcome to ISF College of Pharmacy. As you know that ISF College of Pharmacy, Moga, Punjab is regularly conducting dialogue series under the aegis of Internal Quality Assurance Cell. In this series, various speakers, pharmaceutical scientists and eminent persons are coming to this platform and delivering their expertise. In same, today we have very eminent speaker with us, Professor Dr. Subodh Kumar Dubey, sir. I welcome you, sir. Without
Thank,
taking much time, I would like to introduce Professor Dubey. Professor Dubey is working as Professor, School of Pharmacy, ITM University, Gwalior, Madhya Pradesh. Sir is having total 18 years of academic, administrative, and research experience to his credit. Professor Dubey has completed B Pharm from prestigious Jivaji Vishwavidyalaya, Gwalior, Madhya Pradesh, and master degree in pharmacognosy and phytochemistry from B.R. Nahata College of Pharmacy, Mandsaur, Madhya Pradesh. He has completed PhD in pharmacy from Gajra Raja Medical College, Gwalior, Madhya Pradesh. Professor Dubey has published many research publications in peer-reviewed journals of national and international repute. Professor Dubey has published many book chapters, articles, conference procedures, newspaper columns, etc. He has contributed various book chapters. His area of specialization is phytochemicals and phytochemistry. He is also one of the author of elsewhere book entitled Recent Frontier of Phytopharmaceuticals Application in Food Pharmacy, Cosmetics and Biotechnology. Another chapter in antioxidants and nutritional value in the same book. He has published various textbooks of pharmacognosy from New Age publisher Delhi and Sri Sai publication Meerut, Uttar Pradesh. He has many Indian design patents granted and many Indian patents published. He has attended many international, national conferences, symposia, workshop, STTP, FDP. He has many research publications, almost 5 dozens, including 15 international and 35 to 45 national. He received many prestigious awards in pharmacy field and also completed research project BIRAC, BIG, SI, DBGI Innovation and Incubation Center, SIIC, IIT Kanpur, worth 28 lakh rupees. He is a scholar, guide in MPharm and PhD. He has guided more than 18 MPharm students, more than 3 PhD students has been awarded under his kind supervision. Almost 8 candidates are registered right now under his research team. He also is advisory member of various institute of pharmacy, coordinator School of Pharmacy, ITM University, Gwalior, Madhya Pradesh, coordinator Board of Studies in School of Pharmacy, ITM University, Gwalior, Madhya Pradesh, and departmental research coordinator of School of Pharmacy, ITM University Gwalior. He is also PhD PG guide examiner to various universities, ITM University Gwalior, RGPV Bhopal, Amity University Gwalior, Pandit Ravi Shankar Shukla University Raipur Chhattisgarh, Deen Dayal Upadhyay Ayush University Raipur Chhattisgarh. He is a lifetime member of APTI, IPA, and he is a registered pharmacist of Madhya Pradesh State Pharmacy Council. Overall, Professor Cooper is a you and have a very healthy future. With this bias, I would like to uh, welcome you sir, on this I and I would request you to start up with your proceedings.
am I audible?
You are audible, sir. Very audible.
Thank you, Saurabh sir. Thank you for giving opportunity to me. So, good afternoon, everyone. So, today my presentation topic is herbal medicine. Better is a better health channel. So, we will discuss in this presentation what are the demand of herbal medicine and what are the growth of herbal medicine and what is the role of herbal medicine in our life or our health. So global demand of medicinal plants. The global demand of medicinal plants has been on the rise in recent years due to various factors such as increased interest in natural and alternative medicine, a growing global population, and a greater awareness of the potential health benefit of herbal remedies. So medicinal plants have been used for centuries in traditional and indigenous medicine system, and continue to be an important source of healthcare for many people around the world. So, as per the WHO, the global market value for herbal industry is expected to reach $5 trillion in 2050. So, the global market growth for the industry is expected to be 7% per annum from year 2000 to 2050. Means annual, it's a 7% annual growth, which is showing in the graph. So global market value for our industry is much in more in 2050. So it's a global demand of the medicinal plant. The next point is, or step is status of medicinal plant in India. So there are many advantage and disadvantage of the medicinal plant status in India. So medicinal plant play a significant role in traditional system of medicine in India, such as Ayurveda, Siddha, and Unani system of medicine, or modern health medicine. Modern system also, or pharmaceutical industry. India is one of the world richest repositories of medicinal plant due to its diverse agroclimatic zones. So some advantage and disadvantage, or means we can say opportunities and the challenges. So 20 agroecological zones, one of the seven mega biodiversity countries. These are the opportunities. 7% of worldwide biodiversities, 17,000 flowering plants species, about 90,000 species used in ISM and fog medicines, 72 species in trade, of which 242 with consumption more than 100 metric ton, and 40% of species in high demand sourced through cultivation, and a large network of institution university involved in medicinal plants R&D. So these are the opportunities, and some challenges like exploitations, habitat loss, climate change, illegal trade, lack of regulations, and alternative land use. These are the some challenges in the cultivation of medicinal plants. So it is the status of the medicinal plant in India. So the next is, India is repository of more than 7,500 medicinal plant found in Himalayan to marine and desert to rainforest ecosystems. So this one is the next point in my presentation. So India is indeed a biodiversity hotspot and home to a vast array of medicinal plants. Due to its diverse ecosystem ranging from the Himalaya mountain to coastal areas and from desert to rainforest. So the country's varied climatic and ecological condition have given rise to a rich flora with numerous plant species possessing medicinal properties. So the number of medicinal plants found in India is estimated to uh, be well over 7,500. These plants are used in traditional system of medicine such as Ayurveda, Unani, Siddha, and in modern pharmaceutical and herbal industry. So there are some like when talking about the repositories, so Himalayan region is the means we can say it is forest. So the Himalayan region is treasurer trove of medicinal plant. It includes a wide range of uh, altitudes and climatic conditions, making it home to numerous plant species with medicinal value. The Western Ghats, the Western Ghats along the western coast of India are another biodiversity hotspot known for their rich flora, including many endemic medicinal plants. Eastern Ghats, the Eastern Ghats running along the eastern coast of India also harbor a variety of medicinal plant species. Desert ecosystems in arid regions like Rajasthan, you can find medicinal plants adapted to the harsh desert environment. Plant like aloe vera and neem are example of species found in these areas. Rainforest, India's northeastern state and part of the Western Ghats are home to lush rainforest where many unique and rare medicinal plants can be found. Coastal areas. So coastal region of India, including the western and eastern coast, have their own set of medicinal plants that are adapted to the saline environment. So these are the areas, and the plain and plateau, the central and the north plains, as well as Deccan plateau also support a variety of medicinal plants and wetland and marshes. So wetland ecosystems, including the Sundarbans in West Bengal and the Kerala backwaters, have their own medicinal plant species. So these diverse ecosystems contribute to the tremendous biodiversity of India's medicinal flora. However, it is important to note that while India is rich in medicinal plants, their sustainability and conservations are crucial, as overharvesting and habitat destructions can lead to the depletion of these valuable resources. Effort in cultivation, sustainable harvesting, and the conservation of these plants are essential to ensure their availability for traditional medicine, pharmaceuticals, and other uses. So it is the that's why we can say कि India is a repository more than 7,500 medicinal plants found in Himalaya to marine and desert to rainforest ecosystem. So this one is India is a known, that's why India is known as a botanical garden, because we have different climatic zones in India. That's why India is a repository. Am I audible?
Yes, sir. Yes, sir.
So the next, demand of medicinal plant from health sector. So what is the demand in the different medicinal system or Indian medicinal system? So like about 2,500 plant species are used in all the codified system of medicinal practice in India. So like Ayurveda, Siddha, Unani, Soa, Rigpa, homeopathy, and Western. So 15,087 species required in Ayurveda. Siddha is 1128. Unani is 503 species. Soa, Rigpa is 253 species. Homeopathic is 468 species. And Western is 192 species. Because Western also use the medicinal plant. We will discuss further. So Western also use the medicinal plants because 25% of the drug is formed by the botanical source in allopathic or synthetic drugs. So what is the demand of raw herbal drugs in growth traits? So the estimated demand during the 92 2000 is 2,34,675 metric ton, and estimated demand during 5 to 6 is 3,19,500 mt, and estimated demand during 14 to 15 is 5,12,100 mt, and estimated demand in the future like 16 to 23 is 9,78,000 MT. It is expected demand of herbal medicine, which is showing in the graph. So it is the demand of raw herbal drugs in growth trends. So gross volume of foreign trade of botanical raw drugs, so which is showing in the graph, the export graph is increase of herbal medicine. So the trade volume of export of botanical raw drugs has increased from about 56,000 to 15 MT in 2005 to 6 to uh, 1,34,437 MT in 14 to 15. So registering an average annual increase of about 11%, and import is only 7%. So it is increasing year wise. So the gross volume of foreign trade of botanical raw drugs is increasing. Uh, Means the demand of the herbal medicine increases. Supply of medicinal plants. So 2042 plant species recorded in high annual trade. So excluding 57 species that are cultivated mainly to purposes other than medicinal use. So 7 species that are cultivated for aromatic oils, 4 species for which availability of plant sources could not be verified. So forest, we have 114 species. Himalayan forest is 36 and tropical forest is 78. Wasteland is 59 species. Cultivation 54 species and imports 15 species. So the means we can say कि our forests have rich in the supply. So nearly 72% of the species in high demand continue to be sourced from the wild, with only 22% sourced from the cultivation. That's why we can say that India is a botanical garden, because we have different climatic zones. That's why India have rich in the herbal medicine or herbal sources. So segmentations of Indian herbal market. So what is the herbal segments? So segment of the India herbal market refer to the division of the market into distinct sub-markets or segment based on various factors. So the Indian herbal market is diverse and included a wide range of products and consumers. So market segmentation helps businesses and stakeholders target specific customer groups more effectively. Here are some common segments within the Indian herbal market, like ASU and homeopathic formulations, proprietary ethical OTC medicines, herbal cosmetics, herbal teas, functional foods, nutraceuticals, extract phytochemicals, resins and gums, flavors and fragrance, aromatic oils, aromatherapy, culinary herbs and spices, and veterinary herbal products. So it's a big areas where the demand of herbal medicines, and means we can say that this one is these areas are the market of herbal medicines. So Indian system of medicine. So there are 4 or 5 Indian system of medicine, like Ayurveda, Siddha, Unani, Suarikpa, homeopathy, Western. So Ayurveda, the basic principle of Ayurveda is we all know very well. The basic principle is three dosha system: Vata, Pitta, and Kapha in Ayurveda. Base of the all systems, but the all system saying in other words or in other way. So the basic principle is different, but it is totally based on the Ayurveda. Siddha also saying your food itself your medicine, the basic principle of Siddhas. And the Unani system is based on the Tabiha. It is the base of Unani. The 7 principles are involved, like Arkan, Mijaj, Akhlat, Aja, Arvaha, Kwa, and Afal. So this is the basic of Unani. Soa Rigpa is totally based like Ayurveda principle. The Soa Rigpa is a Soa Rigpa is a means Jangwa Naga is a Indian system, but is the origin of Soa Rigpa is a China, and it is known as a Himalayan Indian medicinal system. So it is based on the Panchabhuta, and homeopathy likes cure like that a substance that causes certain symptoms can also help to remove those symptoms. And Western is physically examining the body and the associated symptoms. So it's a basic uh, medicinal system of our country, uh, or we can say it is Indian system of medicine. So the major part is used as a drug. So the it is the listing like which part of the plant used as a drug percentage wise. So flowers is 10%, fruit is 7%, bark is 14%, rhizome is 4%, leaves is 6%, and stem is 6%, wood is 3%, whole plant is 16%, root is 29%, seeds is 5%. So it is the means basic. So we are showing here, and bark is 14%. So this is the percentage wise plant part used as a medicine of herbal medicine. So this is the structure of plant parts, and which is showing in the graph percentage wise how uh, which part used as a drug, and what percentage. So the next, because the our topic is the herbal medicine is our better channel. So no alternative of herbal medicine means in we can say in some cases like in a liver disorder. So bicyclol is a synthetic second generation derivative of compound obtained from the fruit of the Chinese Magnolia vine or orange Magnolia vine, because there is no alternative in allopathy for treatment of liver disorder, means hepatitis. And the next is artemisinin. Artemisinin is a derivative of Artemisia annua, so also known as Qing Hao in Chinese. So it's a Chinese plant, but now it is used as a anti-malarial drug, or it is work means we can say it is very important drug for malaria, because it is work in both malaria, Bivax or falciparum. But the quinine is only work in the Vivax. But quinine also is a herbal medicine. So some there is no alternative for malaria, because plant source is only source for the treatment of malaria. So we can say there is no alternative of herbal medicines. Like third one is salicylic acid. Salicylic acid is found in the plant meadowsweet and is used to make aspirin. So aspirin can cause the lining of the stomach to bleed, but meadowsweets naturally contains other compound that prevent irritation from salicylic acid. So it is the betterment of the herbal medicines. So that's why we can say there is no alternative of herbal medicine. Why herbal medicine? It is being used by about 80% of the world population, primarily in developing countries, for primary health care, cultural acceptability, and laser side effects. Ancient literature also mentions herbal medicines for age related disease, namely memory loss, osteoporosis, diabetic bones, immune and liver disorder, etc., for which no modern medicine or only palliative therapy is available. So, means we can say our kitchen also our hospital. Why? Because all these spices have some medicinal effect, like turmeric is a it have curcumin, which is which have some medicinal value. And we know very well कि आपका turmeric act on means protect the liver. So it is used in regular diet in our food. That's why we can say कि our kitchen also is a hospital. Means hospital, not medical store, because it has some cinnamon bark, uh, turmeric, fennel, clove. All are these spices which have some different medicinal values. So your kitchen also your medical store, or it is herbal. So that's why herbal is better for your health. So why herbal medicine? So these are the reasons for use of the herbal medicine, because there is no side effects or lesser side effects, and it is used regularly or traditionally from the 5,000 years before. The popularity of herbal medicine, more than 95% of the population in the least developing countries use herbs for health and other purposes. So more than one third of Americans and Europeans use herbs for health purposes, spending over 7 billion annually, and more than 25% of modern pharmaceutical drugs have botanical origins. So these are the reasons of popularity of herbal medicines. Am I audible?
Yes, sir.
Yes, sir.
So health benefits of herbs. Herbs may help to prevent the manage various diseases. These are the common diseases we are suffering. Means यदि हम बात करें तो घर में कोई ना कोई एक इन परेशानियों से उलझ रहा है, like cholesterol, blood pressure, blood glucose level, cancer. So it is the controlled by the herbal medicines. Cholesterol, the regular diet in our food is garlic. So garlic is a anti-lipidemic or control the cholesterol level. Blood pressure, your in your diet, like cardamom have some control the blood pressure. So it is our food also. So this one control the blood pressure and blood glucose level. Many drugs we are used in herbals, which is which are control the blood glucose level, like uh, spiny guard, bitter guard, and which are our food, na? Bitter guard, spiny guard, and many others, which is control the blood glucose level. And cancer also treated with the help of some medicinal values, medicinal herbal medicines. So these are the benefits of the herbs in the common diseases. So this is our health benefits of herbs. These are the leading herbal supplements, like aloe, astragalus, bilberry, black cohosh, chamomile, cascara sagrada, uh, Chene pepper, Chinese parsley, cranberry fruit, Ichekiana, Ichensia, evening primrose, feverfew leaf, garlic, ginger, ginkgo root, Asian ginseng, milk thistle, Silvum marianum, and nutmeg. So milk thistle plant used in hepatoprotective, like garlic in cholesterol, ginger also cold and cough. So these are our regular foods. So we are follow the Siddharth's principle, like your food itself, your medicines. And like ginkgo biloba is a herbal drugs. So there is no because for मीन्स न्यूरॉन को ट्रीट करने के लिए हमारे पास बहुत सारे ड्रग्स नहीं है, क्योंकि हम उसमें सिंथेटिक पर जाते हैं, तो सम ड्रग्स आर अवेलेबल फॉर लाइक न्यूरोबियन एंड समथिंग, बट इन हर्बल जिंको का इज good effect in the neurons or nerve tonic, as a nerve tonic, because it is used in the tinnitus. So mostly doctors prescribe this drug ginkgo biloba for the treatment of tinnitus. So these are the leading herbs which is used as a drug, and the all are as our food. Some toxic plants, so we can means not confirmly plant have no toxicity. So plant have toxicity, like castor beans plant, Ricinus cuminis contains ricin, one of the most potent natural toxins known. Ingesting even a small amount of ricin can be lethal. Belladonna, Atropa belladonna, have we know very well about the Atropa belladonna. It is work as an anticholinergic, but it is have some toxic effect also. Foxglove digitalis purpurea contains cardiac glycoside similar to oleander, which can disrupt heart function if ingested. And mushroom, so mushroom is a food. It is also as a food material, but certain mushrooms such as amanita species are highly toxic and can cause liver and kidney failure. So these are the some side effects of the plant and some dangerousness of the plant. We should aware about the toxicity of the plant. हमारे को मालूम होना चाहिए कि कौन सा प्लांट में क्या साइड इफेक्ट हो सकता है, क्या डेंजरसनेस हो सकती है. सो इट इज इम्पोर्टेंट फॉर दी एज ए फार्मासिस्ट और एज ए लेमैन को भी मालूम होना चाहिए कि कौन सा प्लांट. जब हम बात करते हैं आपका इथिनो मेडिसिन की, सो एनिमल्स ऑल्सो अवेयर अबाउट द टॉक्सिसिटी ऑफ द प्लांट. जब इथिनो मेडिसिन की बात हो रही है तो प्लांट की टॉक्सिसिटी को एनिमल्स भी जानते हैं. So it is important for the humans to have to idea about the toxicity of the plant, which plant is toxic or not, and it is dose dependent. When we are talk about the opium, so opium is very dangerous because it is narcotic plant. If it is used as a in a small amount, so that is work as a stimulant, and some content like morphine, codeine is used as a expectorant, but it is dangerous and it is CNS depressant also. So dose is major role play in the any treatment or the regulation. So the dose and time is very important also. Is it clear? And am I audible?
Yes, sir.
Yes, sir. Yes, sir.
So some common effects, food and their interaction with various drugs. Like we are eating just some synthetic drugs, herbal medicines also, but some food material also interact with the drug and reduce the absorption or effect of the drug or the food. Like dairy products. So mild cheese, butter, curd, ice cream, all are the dairy products. So effect or common interaction with quinolones, tetracyclines, and bisphosphonates. So these the result is decreased therapeutic effect, reduced absorption. So the solution, calcium-rich dairy products and calcium supplementation should be taken 2 hours before or 6 hours after the interacting medications. If you use dairy product, कई बार हमारे विलेजेस से लोग आते हैं, वो कहते हैं कि सब एंटीबायोटिक खाना है तो क्या दूध के साथ खाएं. पर यदि आप क्विनोलोन्स दे रहे हैं, टेट्रासाइक्लिन दे रहे हैं, तो ये इफेक्ट करेगा, मींस रिड्यूस द एब्जॉर्प्शन ऑफ क्विनोलोन्स, tetracyclines. So it is means a precaution. जब हम बात करते हैं, ये क्लिनिकल बात है, प्रैक्टिकली बात है कि हमारे को बताना पड़ेगा. द नेक्स्ट इज tyramine rich foods, cheese, wines, etc. Common interaction with the non-selective MAOI, monoamine oxidase inhibitors. So phenylkene, tranyl, cypromine, etc. So activity, life-threatening hypertensive reactions. Solution: avoid tyramine rich food when using MAOI inhibitors. So this is the food interaction effect of the drugs. Some synthetic drugs or herbal medicines also. Fiber rich foods: wheat, corn, coconut sheds, and so common interaction with digoxin, amoxicillin, levothyroxine, etc. Results: fiber find drug, gut delaying and absorption. Do not much fiber when taking these medications like levothyroxine, amoxicillin, digoxin, all are. So avoid the fiber rich food when you taking these drugs. Caffeine drinks, coffee, tea, energy drinks, soft drinks, etc. So common interaction with theophylline, prednisolone, ciprofloxacin, and cimetidine. So it is the inhibition to theophylline metabolism with subsequent adverse effect of it: dizziness, insomnia, and cardiac arrhythmias. Solution: reduce caffeine metabolism, subsequently increase the effect of caffeine. So these are the our herbal medicine interaction, or herbal medicine is a better channel for our health. So herbal medicine has been commonly used over the years. So in conclusion, herbal medicine represent a valuable and natural approach to healthcare that has been practiced for centuries in various cultures around the world. While it may not replace all aspects of modern medicine, it offers numerous advantages of those seeking a holistic and individualized approach to health and well-being. So, herbal medicine, when used with knowledge and care, can provide a range of benefits, including symptom relief, preventive care, and a focus on overall wellness. However, it is essential to approach herbal medicine with a well informed and cautious mindset, seeking guidance from qualified practitioners and healthcare professionals. The effectiveness of herbal remedies can vary from person to person, and their use should be integrated into a broader healthcare plan. Ultimately, the choice between herbal medicine and conventional medicine should be guided by the individual's unique health needs, preferences, and circumstances. It is important to consider the complementary and integrative potential of both approaches, as they can work together to provide comprehensive health care. So, it is the conclusion where the herbal medicine has been commonly used over the years for the treatment and prevention of disease and health promotion, as well as for enhancement of the span and quality of life. So means कि हमारे पास अल्टरनेटिव सिस्टम है, लेकिन हम जाते हर्बल मेडिसिन की तरफ है, क्योंकि हर्बल मेडिसिन में हमारे को हर ट्रीटमेंट मिल सकता है. लेकिन कई बार हम लोग इस पोजीशन में होते हैं कि हर्बल मेडिसिन से काम नहीं चलना, तो हमें एलोपैथिक पर भी जाना पड़ता है. तो वो हमारे को इंडिविजुअल्स पे डिपेंड करेगा कि वो किस तरह से डिसाइड करे कि हमारे को किस ट्रीटमेंट की तरफ जाना है. बट वी कैन से कि herbal medicine is better for your health. So this is quotation written by me, we can say. So plant heals our body and mind. So प्लांट को देख के ही हमारे को आधी बीमारी खत्म होने लगती है, हम ये कह सकते हैं. So plant heals our body and mind. So thank you very much. If you ask any question regarding the presentation, you can ask.
Wonderful presentation, sir. Really, this is one of the best talk on phytopharmaceuticals I have ever heard. And I express my sincere gratitude for your participation as a guest speaker in our ISFCP dialogue series, sir. Your presentation was energetic, informative, engaging, thought-provoking. It was very clear to put a lot of thought and preparation you have put to prepare this presentation. It is, sir, showcasting. So, sir, thank you so much once again, sir. Really, this presentation is an eye opener. The gratitude, the attitude of an individual towards the leading herbal supplements and various challenges and the
Thank you, sir.
healthcare systems available, and it is a channel you have, sir, you have shown really wonderfully status of medicinal plants, geographical indications in India, all east, west, north and central zone of India, and the demand of various uh, systems and its estimation and export, import, and supply of plant segmentations, the systems of medicines and the parts, and ultimately alternative and the significance of herbal medicines, its popularity, its benefits in various health disorders. So altogether, sir, it was one of the talk of the times everyone should listen, sir. So this will be, sir, available at our YouTube channel, sir. So, sir, in future also we expect, as per your expertise, to come down over at us
Always, always,
ISFCP and deliver, sir.
always, sir.
And really, we are really feeling proud to have you, sir, on this platform. And once again, sir, I am thankful to both folded hands to our platform. And we have, sir, Ankur Agarwal ji. He has raised the hand, so he want to share something. So, Ankur, sir, if you can hear
Yes,
us,
Ankur.
Mike. Yes, sir. You want to say something, sir? Ankur, sir?
Yes, sir. Thank you, Gaurav, sir. Sir, excellent session delivered by respected. Hello. I am audible, sir?
Yes, sir. You are very audible.
Sir, I am audible?
Yes,
Yes, sir. You are audible.
Excellent session delivered by respected Subodh Dubey, sir. He is my guru and mentor also for lifetime. So, always suggestion and always motivated, sir. Sir, nice lecture, sir. Thank you, sir.